guys, it's Beth here with Aging Care Solutions, providing both experienced professional guidance and personal experience for caregivers, seniors, and their families traveling the care and navigating the care journey together. So today's topic is, you may not be aware of this, is that if your loved one is deemed homebound, there's a criteria that Medicare has that determines whether or not that person can get certain services at home. So Medicare uses a specific or a certain type of criteria to determine whether someone is considered homebound for the purposes of receiving home health services under the Medicare Part A and B. So here's a breakdown of it. To be considered homebound, they have to meet two criteria. The first is that leaving the home requires a considerable and taxing effort. So if this individual, your loved one, your parent, grandparent, spouse, needs the help of another person, for instance, if they need family members or a private aide to help, or requires supportive device like a wheelchair, a walker, or even a cane, has medical condition where leaving the home is medically contraindicated or is unsafe for them to leave the home. Also, if absence from the home is infrequent or for short durations, so for instance, if they go out and they're only going to things like medical appointments, medical treatments like doctor's appointments, dialysis, outpatient therapy, if they're going for religious services, maybe an adult day program, just short outings if they're going to get their hair done or going to a family event, as long as they are infrequent and they don't indicate that the person is able to leave home regularly, then they would qualify for home health services. And I'm going to tell you a little bit more about those. Sorry, I have so many notes opened. One moment, because that is under yes, there we go. So basically, and this was part of, I worked for a hospital system, so I was a home health specialist, so I did help set up these services. So they, under the Medicare coverage, they would be eligible for skilled nursing care, and it's on a part-time and intermittent basis. So this is not a nurse, this is not an RN that is going to come to your house every day. You might see them once or twice a week, depending on what your need is. But you're also can get other services like home health aid services to receive skilled care. So if you need help showering twice a week, then a home health aide provides that service to you. Again, not a daily service covered under your health insurance, but this is one intermittent base visit that is allowed and paid for by Medicare. Physical therapy is another one. So if you've had a hospital stay that resulted in a skilled nursing or rehab facility stay, upon your discharge, you should receive orders for physical therapy. If you didn't have a hospital stay, but you have fallen multiple times or you have a need, your primary care physician can also write orders for physical therapy, occupational therapy. If you've had a stroke and your speech is impaired, then speech language pathology can also come in and be covered under Medicare, and medical social services. So if you have a situation where you are not managing yourself well, if you have a history of depression or you have anxiety disorder or a mental health diagnosis, then social work would come in and be covered under Medicare. Also, if you need any DME, any durable medical equipment like a wheelchair, walker, those are covered under your Part A, and those can be ordered for you. And also certain medical supplies. So if a nurse is coming in to do wound care because you're diabetic and you have wounds, those supplies, as well as the gloves, the gauze, any of the ointments, all of that is going to be covered and paid for under Medicare. What it doesn't cover, what Medicare will not cover, is 24-hour care at home, right? So you're not going to get them to come in. You're going to have to pay out of pocket or have family provide these services to you, like meal preparation, just a lot of things that maybe you are unable to do on your own. Also meals, Medicare is not going to pay for meals to be delivered. Now there's different programs like Meals on Wheels. If you qualify, or if you have pay for a meal delivery service, then of course that would be on you. If you need homemaking service, cleaning, doing laundry, those are not covered under your health insurance, which is your Medicare. Okay, that's again something that is not covered. Personal care like bathing, dressing, toileting, only if when your home health services are there. So if a home health aide is there helping you for your twice weekly shower, there's some little things that they can do. They might empty the trash, or they might help straighten things up. They might help you do some personal care while you're there, like they might help you with a shower. But other than that, your health insurance will not be covered. So if you're planning, to set up care for someone and you can't reach anybody on the phone to try to answer some of these questions for you, these homebound services can be a lifesaver for a lot of families because they can't provide transportation to their loved one. Maybe they live out of the area, or it's a neighbor that you're worried about. If they have Medicare, they likely have, and they are deemed homebound, and they would be when they get their assessment. So you could even call a home health service and say, I have a neighbor that I'm really worried about. Here's her phone number. Can you please call and set up an assessment? Those are ideal for families, where you're really worried about how to plan and how to manage things for them. The other thing that a lot of people are unaware of is that there are primary care physician groups. They're typically nurse practitioners, but they are working under a licensed medical doctor as a primary care physician group. And I partnered with a number of agencies that did this because we would need orders written for somebody who was homebound, so they couldn't get to their primary care, or their primary care doctor retired, had moved out of the area, was no longer accepting new patients, wasn't accepting their health insurance anymore. So for a host of other reasons, they needed a new primary care group to come in and help them. And so I would refer a nurse practitioner to go in. So it's great to have not only a nurse practitioner, but then a home health agency. These are all great layered services that help manage somebody, can do care plans, can really help assess and stay in contact with remote family members who are managing remotely. And if somebody doesn't have a family member, then they're getting the best level of care that they can by having numerous agencies in there to help. So I hope this was helpful for you. I think there's a lot of information out there that people are completely unaware of, and just bringing it to light, helping families who maybe are just in the midst of a family crisis with their loved one right now, and they're really unaware. Oh my gosh, what are we going to do? How are we going? We can't quit our jobs. We have children at home still, or I live across the country and I'm unable to coordinate all these services. What does that look like? And certainly these videos are going to be a real helpful partner to you. The last video that I did about case managers and having someone that can also be a partner of yours. So maybe 90% of the services that you're bringing in could be covered under their health insurance, but then there's that other small amount where assigning a case manager or a geriatric care manager to come in and coordinate and report back to you about all of these services of people who are coming in. They're going to do all the legwork. They're going to write all the reports. They're going to send all the emails and do what they can to stay in touch with you and bring you and keep you up to date on your loved one's care needs. So I hope this was helpful. And if you have any questions, please put them in the comments. Please, I would greatly appreciate if you would like and subscribe. And I'll see you at the next video. Take care.